In this video, we're going to show you how to run a consultation from start to finish. This is the heart of clinical work in Velastria. We'll go through every panel and every option. Feel free to use the chapter markers below to jump to the part you care about. Every consultation starts on the calendar. Here's a typical week. Richard Pemberton, plastic surgeon, with consultations and theatre sessions across the week. Now, this is one of the most important things to know about Velastria. The calendar is right-click driven. To start writing notes, you right-click on the appointment. Not double-click, not single-click, right-click. The second consultation of the day is Melanie Abbott at 10 o'clock for an abdominoplasty assessment. Right-clicking her appointment brings up a context menu with everything you can do. Open the patient record, change the appointment type, take a photograph, and many more. From this menu, select Write Clinical Notes. This opens the consultation workspace for that appointment. The workspace has three main regions. Across the top, a header with patient details and a Save button. In the center, the consultation proforma. 7 tabs, each a different style of clinical record. And on the right, a Tools panel. Recording controls, photos, communications, AI features, and PDF export. The header shows the patient's name, age, date of birth, and which clinic they're at. If they've had previous consultations, you can expand a quick preview without leaving this page. There are 7 proforma styles. General is a free text editor for any consultation. Structured uses the SOAP format: subjective, objective, assessment, and plan. Injectable is for non-surgical work: history, examination, products administered, and aftercare. Operation captures everything you'd want in a formal op note. Diagrams gives you anatomical drawings to annotate. And the 7-day and 14-day post-op tabs are structured follow-up forms. Not every clinician uses every tab. The gear icon next to the proforma title lets you toggle tabs on or off, open the Customize dialog, pick which tabs you want visible, and your preference is saved per account so you only see what you actually use. Back to General. The text editor supports rich formatting: bold, italics, lists, and so on. You can type your notes directly here at any point during a consultation. Autosave runs every few seconds in the background, so you don't have to remember to hit save. If you prefer a structured layout, the Structured tab gives you 4 separate editors: subjective, objective, assessment, and plan. Each is a self-contained section. The Injectable tab is built for non-surgical work. It has separate editors for history, examination, treatment plan, and aftercare advice, plus a product list at the bottom. You can add products manually or scan QR labels from a phone. The QR workflow gets its own clip later in this playlist. The Operation tab captures the formal record of a procedure. You can write the operation note from scratch in the editor. But for procedures you do regularly, it's faster to import a template. Pick one from the drop-down. Let's load an abdominoplasty template. Click Import. The template fills in the editor, and placeholders for patient name, surgeon, date, and procedure are replaced automatically with this appointment's details. Diagrams gives you a canvas with anatomical templates and a set of annotation tools. Pick a body diagram and the annotation tools appear: marker, numbered annotation, freehand draw, eraser, plus undo, and clear. For a 1-week post-op visit, the 7-day tab gives you structured fields for wound assessment, complications, symptoms, and the next plan. 2 weeks out, the 14-day tab covers function, satisfaction, and scarring. These tabs make follow-up appointments quick and consistent. Most surgeons prefer to dictate during the consultation rather than typing. Switch back to General first, then click Start to begin recording. The microphone activates and a timer counts up at the top of the panel. As you speak, the dictation panel below the editor fills in with a real-time transcript. The recording auto-saves every 30 seconds, so you can't lose work. While recording, you can do anything else from the right-hand Tools panel. Click Take Photo to capture clinical photography. Photographs link automatically to this appointment, opening in a new tab so the consultation isn't interrupted. Click Send information leaflets to email the patient procedure-specific information. recovery, risks, what to expect. Pick the relevant leaflets and send. Velastria has dozens already in the catalogue. When the patient is ready to commit, click Patient Consent. Generate a procedure-specific consent form and send it for electronic signature, all without leaving this consultation. The signed consent attaches to the patient record automatically. Click Send. Quote to create a costed proposal. Surgeon's fee, theatre, anaesthetist, all itemized. Send it as a PDF or a payment link. Once they accept and pay a deposit, the quote turns into a confirmed surgery booking. If you need to step away mid-consultation, the pause button stops the recording without ending it. Resume picks up exactly where you left off, handy for confidential phone calls or interruptions. When the consultation is finished, click Stop. Wait a few seconds for the final transcription to come through. The dictation panel will show a tick when it's complete. The transcript is now ready for AI processing. Once the transcript's ready, click Generate AI Notes. Velastria uses Claude to produce structured clinical notes from your dictation, including a summary, examination findings, and a plan. It usually takes 10 to 30 seconds. The result appears in the editor automatically when ready. Generate Patient Letter is a fire and forget. Velastria writes a polished letter to the patient summarizing the consultation in your house style and saves it to their documents. When you're on the Operation tab, the Generate PDF button produces a properly formatted operation note, surgical detail, complications, post-op instructions, and any diagrams on a separate page. Preview opens it in a new tab. Generate saves it directly to the patient's documents. The Preview tab closes itself when you're done reviewing. Before closing, you can book the patient's follow-up appointment without leaving this page. Book Follow-up takes you straight to the booking wizard with the patient pre-selected. Pick a slot, confirm, and the patient gets an email confirmation automatically. Finally, save and close at the top. Write finalizes everything. The audio, the transcript, the notes, the letter, and any PDFs all attached to the patient record. That's the full consultation workspace. 3 things to remember. First, right-click on the calendar appointment to start writing clinical notes. Second, dictate while you work and let the audio recording capture everything. Third, generate AI clinical notes and a patient letter from the transcript at the end. The next clips in this playlist go deeper into individual features,